I want to thank everyone for joining us today for Children's Health in Focus. These are conversations we are holding with experts in the field on timely and important health-related topics. Today's topic is living with trauma, caring for immigrant and refugee children. This is something that's very dear and near to me because I myself am an immigrant into this country from Cuba via Nicaragua when I was 7 years old. I'm Arturo Brito, President and Chief Executive Officer of Children's Health Fund. I'm also a community pediatrician with a long history with Children's Health Fund that began many years ago when I was the medical director of the South Florida Children's Health Project, which is one of the 25 programs that are currently in our national network. In a moment, you're going to hear more about the South Florida Children's Health Project. First, however, a little about Children's Health Fund. We were founded 35 years ago and today lead a national network that brings comprehensive health care to children growing up in under-resourced communities throughout the country. We are currently in 25, we have 25 programs in 15 states, Washington, D.C., and Puerto Rico. Our national network partners deliver services to children where they live. And our partners use a fleet of more than 50 mobile medical clinics, connect via telehealth, and have presence at more than 500 schools, homeless shelters, and other community sites. Before I delve into today's topic, I want to do a couple housekeeping items. First, we ask that everyone keep themselves muted throughout to avoid any background noise. And second, if you have any questions, and we do encourage you to ask questions, please post them in the chat, and we would monitor them throughout the session and get to as many as possible as time allows. So now, when we talk about immigrant children in the United States, it's important to understand the numbers here, right? As of 2021, there were 18 million children who were either foreign-born or who lived with at least one foreign-born parent. We know that these numbers are likely to increase when the 2022 data comes out. And 1 in 4 immigrant non-citizen children lack health insurance. If you go to the next slide, please. So children of immigrants are twice as likely to be uninsured as are children of non-immigrant families. And children without insurance, whether immigrants or not, are twice as likely as children with insurance to lack a usual source of health care. They're twice as likely to have delays in necessary care and medical treatment, and twice as likely to have unmet medical needs. All of these things impact the way that children grow up, and their opportunities to thrive and succeed are lessened because of these lacks that children without insurance have. So we're fortunate today to have with us Dr. Lisa Gwynn, who's the Associate Professor of Clinical Pediatrics and Public Health Sciences at the University of Miami School of Medicine. Dr. Gwynn is also the South Florida Children's Health Project Medical Director, a position she has held for 12 years. And we congratulate you. You just celebrated your 12th year, if I understand that correctly, Lisa. She leads a team that provides comprehensive health care. And when we say comprehensive health care, we mean medical care. We mean mental health care. We mean making sure that children have the health-related social needs or social determinants of health met on a regular basis for children growing up in under-resourced communities throughout Miami-Dade County. Beyond providing patient care, Dr. Gwynn is a consummate advocate. She is always fighting for the rights of children, for all children, to have access to quality health care. And she works to break down barriers that prohibit access to health care for children, regardless of where a child may have been born. So Lisa, thank you so much for being here and joining us today. I think a good way to start this conversation is for you to tell us a little bit about the kind of patients that you see and serve in South Florida.
Well, thank you so much, Arturo, for this opportunity to share, give perspective of what we see in South Florida. It's interesting. I'm not an immigrant. I was born and raised in Miami. But, being a native of Miami, I have seen, the patterns of, immigration and immigrant children within our community. I myself, in my neighborhood, I was raised in Hialeah, and my first best friend was from Cuba. She didn't speak English, I didn't speak Spanish, and somehow we were able to communicate. So my connection to the immigrant populations within South Florida, run very, very deep. So, our project is entering its 30th, actually just finished its 30th year. And what we've seen in our community, it has never, immigrant children continue to come through this community and settle in Miami. And what has changed really is the number of kids that are coming from all over the world. Before it was just, the Caribbean basin, Haiti, Cuba. Of course, it has extended to Central South America, but that's not all. I mean, now we're seeing families coming from all over the world. And so it's really broadened our the need for us to be able to provide healthcare to these children.
Yeah, when you mentioned that this is 30 years that the project has been in existence in South Florida, it reminds me how this project had its beginnings. That project started in South Florida, like a number of other projects in CHF's national network started after Hurricane Andrew in 1992. And when I joined there as a medical director in 1994. The original thought was that it was going to be needed for a few years because of the need that a lot of families had, particularly in the southern part of the county, had because of the impact of the hurricane. But what we discovered over the years was that there were needs that preceded the hurricane for many of the families. And as you just stated, the growth of that need has unfortunately increased. It's gotten worse, not better, over the years. I think it's also interesting because when people think of Miami-Dade County, they think of Spanish-speaking nations that immigrate there. However, as you just said, over the years, especially in recent years, you have, my understanding in talking to you earlier about this is that you have kids have come from Afghanistan, Ukraine, in addition to continuing influx of immigrants from the Caribbean and Central and South America.
Yes, definitely.
Yeah.
Definitely. Even Russia, there we have a Russian population that we care for as well. So yes, it has become much more international. So yeah, all with very unique healthcare needs and limited access to healthcare.
So there were pictures of you earlier in front of the mobile clinic or one of the mobile clinics. Under your leadership, that program has expanded over the last 12 years. Can you say a little bit about the kind of services you provide on the different mobile clinics or the van? I know you have an immunization van that you rolled out during COVID in particular, or expanded, and maybe say a little bit more about those services.
Sure. So our main medical unit, of course, is similar to most of the models of, within the network. And that is, we provide comprehensive medical care. We have social work. We have mental health as well. So that's gone on consistently. We have expanded our fleet. We have a second unit. Over the pandemic. We were able to secure funding for an immunization unit. And we call it Shots to Go, shots with a Z. And it goes into underserved communities and parks at schools and provides, and we work in partnership with the school district to provide children that don't have access to healthcare with immunizations. We just refurbished our previous unit that was not our original unit, but our second unit. We refurbished it and it just arrived last month. And that unit is a hybrid model in which we have an exam room in the back, but we also have additional immunization stations because the Shots to Go unit has really taken off. I mean, vaccine rates since the pandemic have continued to plummet. So that third unit is going to be used as a hybrid, so where we can do both immunization drives as well as see kids that need physicals.
Yeah. I'm going back to questions I used to get an awful lot, and I still get now at Children's Health, but certainly when I was on the mobile clinic in South Florida, is about, the perception that because these are mobile clinics, that patients are seen as one-off visits, et cetera, but that's not the case. I know that the comprehensive health care you provide is as good, if not better, than what you would get in a private pediatrician's office. It's just a doctor's office on wheels. Can you say a little bit more about the type of sites you visit and some for the more comprehensive health care beyond immunizations that you provide to the kids, your relationship with those sites, and also how often you may go to some sites more than others?
Right. I mean, we're at capacity. There's never seems to have to be enough. So we are stretched, but we span the entire county. We go as far south as Florida City and Homestead, which is very rural, a large migrant farm worker population. And we go as far east as Hialeah and Doral, which is more of a, it has Venezuelans and different and Cubans as well. So, it's interesting. Every neighborhood that we go into, it's a different culture. It's a different level of health literacy. It's a different level of unmet health needs as well. So certain countries that these kids come from, they have even more limited access than perhaps others. And so every day is a different journey. Our staff is absolutely amazing. We provide culturally competent care. All of our nurses and pediatricians are multilingual. And so, we do our very best to make sure that all of their healthcare needs are met, as well as their mental health care.
Yeah, and it's clear from a recent site visit I did in South Florida, met with you and others, and patients and families, that the care is just what every child really, the care that you provide and your team provides is what every child deserves and should be receiving. Because if we really believe as health as a human right, which I know you do, that any child in the United States, regardless of the place of birth, we believe should get the health care that any of our own children we would want them to have.
I do want to add too that there is a lot of education when we see these families that we do want them to come back. The concept of having a medical home is kind of foreign to them. They don't understand that concept. We have to explain to them that this is a program that we can be your child's doctor. Your child now has a pediatrician, has a team that can take care of them. So when we tell them this, they just can't even believe it. But that's our goal. Our goal is not to be a one-stop shop, but to be that medical home for them, and to, if they are eligible to obtain health insurance, to make those connections also. Unfortunately, most of our families do not qualify for public assistance. So many of them end up staying within our system.
Yeah. I know that you feel this way, and I can hear it in your voice, that I'm proud to be part of an organization that cares about all children. And in addition to that, it's not just that we care about all children, it is also the smart thing to do is to provide care to all children in this country, because evidence has shown, particularly in pediatrics, when you provide comprehensive health care, you provide immunizations, you provide education and focus a lot on education, it actually reduces the number of emergency room visits that otherwise they wouldn't be necessary, a number of unnecessary hospitalizations, and therefore improves health while lowering healthcare costs. And I think that's what people don't think about sometimes. Can you tell us, just give an example, the type of conditions you might see, given that you see children from all over the world right there in Miami-Dade County?
We see everything you can imagine. I was in private practice for almost 9 years, and that doesn't compare to what we see out in the mobile clinic. We see everything from basic issues such as anemia, nutritional deficiencies. Many have vision problems. We do all of the basic screenings that are required for school entry. So, some have hearing issues, vision issues, and some are more complicated. We've identified some serious issues that require hospitalization. Sometimes they show up at our doors and we have to call rescue because they're sick, and they don't have transportation to get to the hospital. So pretty much you name it, we've seen it. And I will say that I also work on the inpatient side from time to time, and there's a lot of children that we take care of in the hospital that are uninsured that end up following up with us because they don't have health insurance. They don't have access to a medical home. So many times we end up seeing these patients after they're discharged, and we continue to be their doctor.
Yeah. And in addition to the medical or physical, because it's all medical, physical conditions some of the children may present with that you have to manage and hopefully prevent from getting worse. We know that the vast majority of immigrant children that come into this country are understandably having to deal with emotional or mental health issues that other children may not have to deal with. Can you talk about how you might tackle mental health issues, given that you have an incredible team? However, for mental health issues, the resources never seem to be enough, right? So can you say a little bit about that, how you approach that, and what are the resources you might need to do more in that area?
Right. Well, first of all, this is probably one of the most concerning things to me now over the last several years, especially since the pandemic. Not only are these kids coming over with, mental health concerns, but when they arrive here, kids that have lived here are also going through depression and mental health issues. As we all know, this has become a public health crisis for children in America. So it's almost like a double whammy for them. So it is vital that we provide mental health services and screening and referrals, on our unit, because we know that they're just, it's desperately needed. So we have a great team that can manage things on site, issues that occur on site. We have an amazing social worker who's been with our program forever, Gladys Campa, who's also a licensed mental health counselor. We also have an amazing clinical psychologist, Dr. Anai Quadra, who also can deliver therapy right there on site. But sometimes that's not enough. And thankfully, our Gladys manages to find a way to plug these families into care and resources in the community. And thankfully, Miami-Dade County does have a network of assistance for these families when they need more than what we can provide limitedly. So
yeah, I'm smiling because I worked with Gladys. She's been there a long time, and that's one thing that's and Dr. Quadra too.
yeah.
That we have staff on these mobile medical clinics and our programs nationwide that are dedicated to the cause and also very, very skilled at what they do, including yourself. I want to turn a little bit to making sure that people that are listening in for the first time understand that we bring best practices and innovations into our programs with leadership such as yourself. And during COVID, we know that telehealth use increased nationwide across all sectors. However, you were ahead of the curve on this, and you were providing telehealth services through the mobile clinic, no less, which no easy task, but you were able to do this and figured it out in a very productive way. Can you say a little bit more about telehealth services you've provided in the past and what your plans are or dreams are for the future for doing that?
Well, I want to give a shout out to the Children's Health Fund because you all were ahead of the game with EMR. So you set the bar very high. We had electronic health records on our units way before it was even, in vogue within the, bricks and mortar clinics. So kudos to you all. And through funding and support of the Children's Health Fund, we were also able to establish a telehealth program. And our model is we bring specialty care through our health system directly to our patients in the neighborhoods in which we live, directly on the bus. So we have equipment that allows us to communicate with the specialists, and we have medical devices that plug into the computer, and we are able to actually conduct a live visit remotely, and the specialists can see the patient and interact with the patient, and at the same time they're able to see the information that's coming through with the medical devices. So we've had success with telecardiology. We're starting up a pulmonary clinic next year. We've had dermatology clinics, endocrinology. So it's truly been amazing. We've at the same time that we're running our medical clinic, we have one room that's dedicated to telehealth. And we've been able to successfully connect these families to specialty care that they otherwise wouldn't be able to access.
Yeah, right. I can't wait to see that clinic virtually, right? So, in spite of your work and your efforts, there's still barriers to particularly immigrant and refugee children in your communities that you serve to receiving the healthcare services that they need. Can you say a little bit about what kind of barriers you're facing right now?
Well, in the state of Florida, there's a lot of barriers. Unfortunately, immigrant children are not eligible for Medicaid. They can buy into the CHIP funded health insurance plan, but it quite frankly is unaffordable. So that's one barrier. Unfortunately, we continue to fight for that in advocacy efforts, but at this point in time, we haven't really made much progress. The other barrier is transportation. Our families just, they have to take 2 or 3 buses sometimes to get to our clinic sites. So that's always a large barrier. And the language barrier, being able to navigate through the health system in general, if they need to go to a specialty appointment, that's very daunting to our families as well. So, that's why we have dedicated staff that, hold their hands, walk them through, what to expect, whether it's education, we advocate for these students when they have special educational needs, special healthcare needs, you name it, we're there to advocate for them so that they can get, whatever it is they need.
Yeah, it's clear that you define comprehensive healthcare. It's clear, and the children and families in South Florida are lucky to have your leadership and the team working down there and building on the 30 years of that experience there. If you had one wish that could be fulfilled to be able to provide services the way that you think they should be provided to all children and families in South Florida, what would that wish be?
Hands down, equitable access to healthcare for every child. Every child deserves to have healthcare, to have a good education, no matter where you're from. It shouldn't matter. It shouldn't matter where you're born, where you come from. Every child should have equitable access.
Yeah, I think going back to a point that you made about Medicaid in Florida not reimbursing for services provided to newly arrived immigrant children, a number of states have moved forward to use their own state dollars to do that. Because it's the humane thing to do, right? And B, because it's also the smart thing to do from an economic point of view. By providing these prevention services, all the evidence shows it actually saves dollars for those states, not even just in the long term, in the short term in many cases, as you're preventing, again, unnecessary emergency room visits and hospitalizations. But if we're not going to do it for the reasons that are in our hearts, we should do it because it's also the smart thing to do.
Yeah, it's an investment in our future. I mean, and I go back to the educational piece to this as well, because we know healthy kids are able to learn and reach their maximum potential, right? So, at the end of the day, this is our future. We're investing in our future. And so, it doesn't take a whole lot to keep a kid healthy, give them their vaccines, make sure they're, they can see that and they can hear, and it's pretty basic.
Yep.
So providing those basic healthcare services so they could really thrive in school and, like I said, reach their maximum potential so that they can contribute to society and to, the betterment of our country and our planet, for that matter.
That's a good way of putting that. So, Jill, I don't know if there's any questions that come through to you or through any other means.
No, not currently.
Good. Okay. So with that, I just want to ask you then, in terms of the actual services you provide, if you could expand those services right now, where would you expand? Is it, yeah, you can list as many as time allows.
So, well, we pretty much cover everything from a primary care perspective. actually better than some of our primary care clinics in the health system that I work for. We pretty much set the bar high. I have to be honest, I would love to be able to take care of their parents.
Okay. Right.
You know, to have just a true wraparound service, you know, because the parents are struggling as well. And we know that if parents are struggling, it's hard for kids to succeed and to thrive when their parents aren't thriving. So
Right.
if I had one wish, that would probably be it.
Great. Yeah, a child can only be as healthy as their parents and caregivers. So I think that's a good way to kind of bring this full circle. Lisa, Dr. Gwynn, I want to thank you so much for taking the time today to share with us everything that you are doing there and everything you stand for. I also want to thank you for the 12 years you've been partnering with Children's Health Fund as the medical director of the South Florida Children's Health Project and growing that program and bringing the latest in technology and innovation to make sure that every child in your community and all the communities that you serve has the healthcare they deserve and need to thrive and succeed in life. And I want to thank our listeners for tuning in and participating in this today. Feel free to reach out to us with any ideas you have for us. And of course, if you have ideas for supporting us, that'd be great. But any questions you may have and clarifications, we're here for you. And we hope you join us in 2023. We'll be sending out notifications about our future Children's Health in Focus sessions and hope to continue these conversations going into 2023. Details to follow. Thank you all.
Thank you so much. Thank you, Dr. Gwynn. And actually, we do have one question if you have 2 extra minutes, and I think it's an important one.
Sure.
So the question is, do you have guidance on the types of partnerships you have been a part of to accomplish your work?
Well, I think partnerships are key. Community partnerships. You know, we partner with community stakeholders, but also with funders. And so finding, you know, identifying stakeholders that serve our population of families is vital and is key. We have a nice blend. It's kind of an organic way that, you know, over the years, we have state funding, we have local foundation funding. Of course, we continue to have our support from the Children's Health Fund. We have research dollars. So it's kind of a blend of different funding opportunities, which has helped us to succeed and to maintain sustainability.
Yeah, and Jill, if I could add to that, I think it's really important for people to understand that all of our programs that we partner with are either affiliated based at either an academic medical center / children's hospital, such as the South Florida Children's Health Project at the University of Miami School of Medicine, or at a federally qualified health center. And it's important because that's where the partnerships begin. And then they go on into those communities to partner with schools, WIC centers, other community centers, and other fixed site clinics to really make sure that kids receive the comprehensive health care they need. So
we couldn't do it without our partners. We really couldn't.
Yeah.
Well, thank you both for taking time to answer, and thanks everyone for attending.
Thank you. And thanks everybody.
Thank you all.
Bye-bye. Happy holidays.
Happy holidays as well. Take care.